Well, congratulations. You've somehow made your way to a moment of light of enlightenment, otherwise known as a Chromium presentation by Joe Mashinsky and Ambrose Lovely. Joe's going to get us started off.
All right, and what it is. So it is a naturally occurring heavy metal, and it has two main forms. It's triplet, which is Cr3, and hexavalent, which is Cr6. And we're mostly going to be talking about Cr3 in this presentation, and the reduction of Cr6. And it is the one people consume. It's the one that everyone's going to use a supplement for. It is absorbed through the GI, lung, and the skin. And it can come from vegetables, meat, urban air. Just some examples. If you're cooking with a stainless steel, it can be absorbed into the food that way. It's also in some whole grain, vegetables, some cereals, beef, and so who would use it? Some health benefits could come from people that have diabetes, metabolic syndrome, have weight and lean body mass problems, or dyslipidemia. But according to the European Food Safety Authority panel on dietetic products in 2014, they did not classify it as an essential nutrient, but it has been able to show some benefits depending on the individual, but mostly with glucose tolerance, but I belong to something not related. And the exact mechanism of action isn't known, but it can help carbohydrate, lipid, and protein metabolism by potentiating insulin action. And how it does this is it binds to oligopeptide to form chromiomodulin and chromium binding substance that binds and activates the insulin receptor to promote insulin action. Oh, and it also can help the immune system, and it can also decrease it, but the evidence behind it isn't substantial. So what are some of the effects? So it increases insulin sensitivity. That's the main thing that does, and that helps with diabetes. It reduces fasting glucose and lower HbA1c with chromium. But again, according to the ADA, it does not support the use of chromium as a supplement due to insufficient evidence. It can also, as stated before, help with metabolic syndrome, dyslipidemia, weight loss. But all just because of insulin sensitivity. It all just increases insulin sensitivity. And if that is the underlying problem, then it will help that. But it all kind of depends on what the underlying problem is with these conditions. Again, but the evidence isn't sufficient to show significant difference with these populations. Again, depending on the underlying problem, but we all know in a group, there's going to be some different underlying problems, so I think we can study based off this. And then some side effects of those drug reactions in warnings. There's no evidence of any just phase adverse effects with chromium. Not all of it even gets absorbed anyway, so it's really hard. They haven't found a toxic level of CR3 yet. The most problematic one is CR6. It's much more toxic, and that's not really applicable in this case, but that's not really what we're talking about. But in case with some adverse drug reactions, if it's taken with insulin, it can cause hypoglycemia, along with any other anti-diabetic medication. And it can also delay the effects of levothyroxine. And what it does is that levothyroxine treats underactive thyroid gland or hypothyroidism, and it just causes that to take longer to have an effect.
Okay, supplements and similar effects. Okay, now if you Google search this, you're going to get phone. Okay, but I think mine is 8.5 billion hits, more or less, but some highlight. Cinnamon, blueberry, shellfish, white tea, Garcinia cambogia, black pepper extract, pickled konjac root, a list of enzymes longer than the arm, and my personal favorite, bovine adrenal cortex, literally pieces of cow brain in your supplement bottle there. So anyway, out of those, I just chose to highlight a couple. One that I wasn't familiar with and one that I'd heard of before. Let's start with the unfamiliar one first. This NVNMN, I'm not going to even try to say a long Latinate word. It's not been shown to increase insulin sensitivity in middle-aged or elderly men, but it does increase insulin sensitivity in obese rodents and overweight and obese postmenopausal pre-diabetic women. Fortunately, magnesium is no respecter of persons, and that has been shown to increase insulin sensitivity in overweight pre-diabetic normal magnesium humans, regardless of gender. So you're going to run into lots of supplements that have similar effects to chromium, especially in terms of diabetes in general and diabetes in particular. Next slide. Okay, so medications that increase insulin sensitivity. Now, there's basically two categories: guanides, and then another one which is called thiazolidinidiones, or TZDs. So those are the two drugs in this class. By far, the most commonly prescribed one is this metformin. It's one of the safest, most prescribed medication to insulin sensitivity, and it's on a 60-year run, which means that for 60 years doctors have been prescribing it, and then all that time it has not stumbled into a class action lawsuit that relegated it to be no longer sold shelf. So it's a pretty good option if you're looking for something a little more familiar. Okay, so an overview of studies and popular opinion. There have been a number of studies done, on chromium. This particular review that I've highlighted, the complementary therapies and medicine review, which you see on the left. Okay, that has they literally looked at all the interventions that included randomized control trials up to 2000. Okay, and basically the findings are that chromium supplementation, can reduce diastolic blood pressure, help improve the metabolism, the body's metabolism, to help it deal with glucose, mitigate the effects of glucose insensitivity more effectively. And again, it's mostly in type 2 diabetes, which is, most of the diabetic problem in the US. So while chromium has no significant impact on systolic blood pressure, BMI, or function enzymes, it does have, a hypotensive effect. It can help with low blood pressure, but in higher doses of chromium, whereas antioxidant effects, are more pronounced at a lower dose. Go figure. So, what's the end of the matter? More long-term trials are needed. Your meta-analyses are going to tell you that, and so does common sense if you start to think about it. So, in terms of a more pop culture, the more pop culture end of the continuum there, the message is, less technical and weedy, but very, much the same as the literature reviews, right? The benefits and risks of chromium, may help with your type 2 diabetes. Possibly, you may wind up losing a few pounds and getting a little bit more lean mass as well. All right, so what would I say to my family members? Not as a PT, but just as a member of my family? You know what? I would say, you want my advice? I'd say, what do you have to lose? Right? It's very hard to, take enough chromium to do yourself any damage, right? In fact, I don't know if it would even be possible to do so, even if you wanted to, unless you've taken medication for what's that problem you mentioned earlier, Joe?
Just other insulin and like diabetic medications or levothyroxine.
Levothyroxine, which is for what again?
Treats underactive thyroid gland or
Right. So,
hypothyroidism.
so unless you've got an underactive thyroid, yeah, the chances of you doing something to hurt yourself very, very low. And you may discover that it does have very positive effects for you in terms of staving off diabetes if you're at risk pre-diabetic sort, or maybe mitigating the effects of diabetes if you've already crossed that type 2 Rubicon. So I say go ahead, give it a shot. There are all of our references. Feel free to go through those. Enjoy the leisure.